Hello, my name is Della Lynn. I am an anesthesiologist and a member of the board of directors of the Anesthesia Patient Safety Foundation. Workplace violence in healthcare is a toxic problem that endangers staff and patients. It can include things ranging from verbal abuse all the way to physical assault.
You're not listening to me. I said we'd do it in the OR.
Workplace violence is receiving attention not only for its effect on staff, but also as a patient safety risk.
Nurse, I'm not sure why, but I think he's not interested in seeing me.
ECRI, a global independent authority on healthcare technology and safety, named physical and verbal violence against healthcare staff among their top 10 patient safety concerns. Workplace violence increases workforce turnover, burnout, and injury. It negatively impacts team communication and information sharing. It hijacks cognitive processes impacting performance, creativity, and work effort.
3 months into this job, but if I keep getting treated this way, I'm gonna have to find something new.
It has a ripple effect on measurable patient safety outcomes, such as hospital-acquired infections, medication errors, and diagnostic errors. Workplace violence is destructive to healthcare workers and endangers patients.